Oh. Rebar whoopsies, a cut above the rest, and of course, don't pull it out. Today we're breaking down and reacting to all the electrifying medical scenes and robotic injuries from the highly popular YouTube channel Murder Drones. Let's dive right in.
Is it supposed to be that color?
Oh! Don't wash your hands, you're a robot, idiot. Okay, that's pretty funny. Got signs to the ER. We actually do have to wash our hands in the emergency department. Anytime we see a patient, you should have your hands washed before going in and actually when you leave. Oh, this is funny. Oh, we got an ice pack on the head. So ice is good. Ice helps decrease swelling, obviously, and numbs up the area. But you also have to think when you put ice on something, it decreases blood flow. So in some situations, putting ice on an area might actually slow down the healing process. Whoa, we got wings. Oh, so a little bit of hole directly through your hand. Obviously, these are little robots. The hand, you have lots of specialized muscles, nerves, blood vessels, and bones. A lot of times, we'll see nails, knives. These are kind of the common things that we'd end up seeing put through someone's hand. Wrap it up, put a bandage on it, like compression, right?
Oof, stuck yourself? Just pop it in your mouth. Our saliva neutralizes the nanites. Otherwise, I'd be constantly disassembling myself.
Very cool. We don't have something like that within our own bodies that neutralize things, minus the fact that we have things that we cannot see with our own eyes having to do with antibodies, T cells, and B cells.
And by our saliva, you mean disassembly drone? Right.
Our human saliva, what's in it? Typically, it's what we secrete in our mouth, helps to break down foods, to lubricate things, but there's a lot of bacteria in our mouth as well. And they say that our mouths as humans are even dirtier than dogs.
No, no, please stop beating my own eggshells in front of my family.
Anybody out there have ever seen the movie Edward Scissorhands? Like literally that's what it looks like. We don't see that many scissor type injuries. The more common scissor injuries that I do see that come through the emergency department are hairdressers and barbers.
Actually, it's gin rummy. So.
Oh. Literally, robot head, goodbye.
Goodbye.
We see people who try to stab individuals in the head and you'll have a laceration to the tissue of your scalp. But a lot of times with the stab wounds, it bounces off people's skull. But the body collapsing, it does that, it loses its muscle tone, so that happens in human beings as well, especially in that situation. Obviously, these type of injuries are not something that we commonly see in the emergency department, but we do see when people pass out, their bodies go limp. Typically, when somebody dies as a human, you don't get an error message, obviously, and the eyes don't necessarily shut on their own because the muscles are not working. A lot of times what we'll end up doing is actually closing the eyelids for that individual.
I'm just letting you know,
Whoa, cut in half? Wow. I know a lot of injuries we see in Mortal Kombat. You can see the vertebrae in the body, the discs in between the vertebrae and the spinal cord, all very cool. Here, because they're robots, you just see melted electronics. What? It's almost like a vampire. Obviously, drinking another human's blood is not good for you. You can develop toxicities relating to what's actually in another person's blood, increased risk of infection. It can also cause nausea and vomiting. Oh my gosh, using a pen as a weapon. Hey, it actually is something that you could potentially use. You gotta be careful. Patients come in and we're worried about getting assaulted. We have to take away anything that's potentially sharp. Oh. Oh, wow, cool. So like a EMP, right?
Electromagnetic pulse.
We do have the defibrillator machine that does send a significant amount of energy and impulse into a human being. Oh, destroyed. Puncture wound through the back into the abdomen. Organs that are kind of closer to the back, you think kidneys. Where your kidneys sit in your back also is different. They're actually off. Whoa. Oh, very cool technology.
Very cool stuff.
We don't have anything really like that in medicine, but we do have telemedicine doctors out there where you can talk to your doctor via a video screen. Oh, he lost a limb, and it is quite proximal. Where the heck are you gonna put a tourniquet, right? You can't. And what would happen is the blood vessel would probably retract even further into that shoulder. Hard to find it to get it stopped. So what you would do, you do bulky dressing. You take your dressings, your gauze, and you just shove it in there.
On second thought, you're way hotter than dull. Run, idiot!
Oh, right through the forearm. We got some rebarb, it looks like. So going straight through the wrist, destroying the bone, hitting an artery. Oh my gosh. Or if you just explode like that, then you don't have to worry about pulling out the rebarb. These robots are next level. When I want to take my day up another notch to the next level, I grab Level Up, made by my company, Life Happens. If any of you out there want to check it out, let me know in the comments and maybe we can send out some samples. Coughing up blood versus vomiting blood. Very common thing that we see in the emergency department. We do need to decipher the two because one's lungs or upper airway versus esophagus and stomach. More commonly, a lot of blood would actually be coming from somebody's stomach, typically from a stomach ulcer. Whoa, right away. Caught it? What happened? Oh, just think about that. Getting a knife through your own hand and then ripping it out. I mean, that takes a lot of control of your pain receptors because your hands and your feet have so many receptors relating to sensory and pain that would hurt a lot. Bullet wound, injury to the head, bone fragments go flying, brain matter everywhere, a blast injury that close that's penetrating, obviously not compatible with life. This was pretty intense, but I will say it was actually quite entertaining as well. There was a lot of overlapping crossing of what actually happens to humans in certain circumstances that this show has given to us. If you guys want me to do more videos with murder drones, let me know in the comments. I read them, I check them out, I listen to your feedback. If you guys enjoyed this, definitely check out this playlist right here. And as always, please do me a favor, helps the channel grow, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.